I suppose the big element of all of this that really motivates me is removing the element of luck that people need to find out about this sort of support. So I often use the analogy that if we think about kind of chemotherapy for cancer services, if someone was diagnosed with cancer, we'd never leave it up to luck or to chance that they got the right chemotherapy. There would be a really defined pathway, I suppose, that if you were diagnosed with this particular type of cancer, these are all the different kind of stages that you go to make sure that you get the right chemotherapy. We'd never tolerate it where you had to pick up a random leaflet in the waiting room to find out about, to get the right bit of chemotherapy, or to have to go hunting through a support group, or by chance a healthcare professional mentioned it 3 or 4 years later that you then got the right treatment. We would never tolerate that for something like cancer. Yeah, actually that's exactly what we seem to tolerate for things like self-management support. We often hear people say things like, oh, well, it was only by chance several years after I was diagnosed that this healthcare professional mentioned this particular programme to me, or I was sat in the waiting room at the GP surgery, picked up a leaflet, and that's how I found out about it. So it feels like actually we've got enough evidence now that we shouldn't be relying on luck for people to be accessing the support that actually we know and we believe really, really works. I suppose the other challenge around personalised care is that lots of people are doing things which are exceptionally personalised, all about empowering and enabling individuals, but don't necessarily use the phrases that we use within the NHS. So for example, the Invictus Games, we were involved with the sailing component of that. Fantastic programme that I saw being probably one of the most effective interventions to support people to self-manage, a really good example of personalised care. But actually the Invictus Game team don't use that language. They talk about sport and they talk about recovery. So it's about trying to identify that actually we've got a really cool common set of principles, and there's a lot more happening that's just not called personalised care, because actually it's what organisations have done for a number of years. But if we can use that label of personalised care in a really helpful way, it kind of gives some of those organisations and programmes a bit of a VIP ticket to get to the front of the queue when they're coming to talk to the NHS, because it's what we call it.